Doctors of Reddit, what are the dead giveaway signs that someone is faking? Whenever the symptoms aren't there, when the patient doesn't know they're being watched. I had someone fake a stroke recently and walked in on her walking around her room independently, after pretending to be limp on her left side. Letting us take complete care of her and wiping her butt for her. It was wild. Y'all. My IQ attending has a great story about caring for a stroke patient during his fellowship. The stroke patient was a frequent flyer. And despite everyone knowing that she was faking her paralysis, she still received care. Until one day when he was really fatigued, he was told by a nurse that the patient was being rude and refusing therapy. So he walked into the patient room and said, "Ems. Blank. This is absurd. I know you're faking your paralysis. Everyone knows you're faking. We are all sick of this." And left. The patient walked out AMA. If someone is unconscious, make a fist and rub your knuckles against their sternum, chest bone. Put some pressure behind it and rub quickly up and down, up towards chin, down towards belly button. It's called a sternal rub and is incredibly painful, but won't harm the person. It's very hard to completely ignore and continue with the ruse of faking being unconscious. The only more sure thing is asking your partner to hand you the eye needle to take some ocular fluid while they're passed out so they won't feel the pain of the needle in their eye. There's no ocular needle. At least not on an ambulance. We say that because not everyone knows that and they don't want to risk it. To RIP my inbox. Apparently the sternal rub isn't common practice anymore because people literally went too hard. Sorry. Also I feel old enough now. Not a doctor but a paramedic. Tons of calls to the jail for inmates with seizures. I lift the arm over their face and let it go. They'll move it to prevent hitting their face, or I'll lightly brush their eyelashes and they'll twitch to it. Bro, I work at the jail as a detention officer. We really hate calling you guys when we know people are faking BC. We do the same things. But the nurse oftentimes doesn't want to take any flack and just makes the call. Sorry for wasting your time. My wife is a doctor and she had dealt with people faking things like one of their legs simply not working. The trick is to tell them to do some other thing with a positive phrasing, making it seem like doing so will prove the patient's story is true, while it proves the opposite. This works for both people who are actively faking it and people who have subconsciously convinced themselves the problem is real. For example, if they say their right leg can't move, you first ask them to try lifting it, which they try and obviously fail to move or flex any muscles in it. Then you act intrigued and say something like, "Now your left leg is the one that works fine, right? Go ahead and lift it up for me for comparison." While they are doing this, you still casually have your hand on their right leg, which you had placed there when you were feeling for any activity when they tried to lift it. Now when the person is laying there and lifts their left leg to prove their right one doesn't work, they will naturally flex their right leg to provide balance with their left leg in the air. If they are able to flex their right leg then but won't even flex it when they claim to be trying to move it, then you know their leg still works. You just have to narrow down if they realize are faking it intentionally. Not a doctor, but I once had a nurse tell me something that stuck with me ever since. I had a gallbladder attack when I was younger. And lem tell you, that's some of the worst pain I've ever felt. I was doubled over, vomiting bile, and unable to move. My mom took me to the ER at 1 AM in the middle of a snowstorm. As the nurse was doing my initial evaluation, she asked me the standard on a scale of 1-10 pain question. I thought for a couple seconds and told her 7 or 8. It hurts really, really bad. She nodded knowingly and told me got it. It hurts really bad. Most people who tell me 10 are lying. No one ever feels a 10 inches. In hindsight, I'm not sure that's the best practice for a nurse. Still, after seeing drug-seeking patients myself, I understand her frustration. They ended up giving me morphine, which brought that number down quite a bit. Edit. I want to clarify my, or rather the nurse's, comment. People can definitely feel a 10 on the pain scale. And I don't want to invalidate your experience if you've felt that. I think the point is that if you do feel a 10, The medical providers will probably know without having to ask. Conversely, if an otherwise lucid and calm patient replies with 10, they might not be telling the truth. Most often their story description exam doesn't make any sense. There are usually things that contradict each other. Abdominal pain is generally easy to tell when people are faking it. For example, I will press with my stethoscope instead of just listening. They don't respond to that pressure but will when I use my hands instead. Sometimes I'll ask them if they are experiencing a symptom that will rule out a diagnosis or make it less likely, and many times they think I'm asking it to support their supposed issue, so they will say they have it. Most of the time people aren't faking but just blow their symptoms out of proportion. Hey guys, just wanted to remind everyone to be careful here. Patients lie. That's true. But it's important to remember that in the US there's massive levels of discrimination and lowered standards of care for many patients due to staff's perception. Be very cautious. Thinking someone's faking when they're really not can lead to serious consequences for both staff and patients. Because of the opioid epidemic, many of my colleagues have decided to almost never prescribe narcotics. Regardless of the situation, I've seen patients in the ED discharged the day after major abdominal surgery with only Tylenol, acetaminophen, paracetamol. Now, I'm no candy man, but I'm always on the wrong side of the curve on the quarterly prescribing reports. I don't want to get anyone hooked on pain medication, but I would rather be fooled by 100 drug seekers than send someone home in real pain with nothing but suspicion and judgment. As a patient, it's apparently very sus if you say you don't want an oxy script. I had some shitty happen. Doc started filling one out for me, and I told him not to bother, since I wouldn't fill it. He got annoyed and said he wouldn't prescribe anything stronger. I got annoyed and said I didn't ask for anything stronger. For FKED reasons. Oxyhydrocodone don't work for me. Advil literally does more for me than any of those. So I'll just take ibuprofen. But apparently the way I phrase that makes doctors think that I'm asking for better meds instead of explaining that I'm just not going to bother with the worthless ones that they default to. One time I was in hospital with decompression sickness and neurological damage and I couldn't piss. I told a nurse I needed a catheter, which she did right away. And I filled 3-liter bags straight off. Anyway, she commented that if a man actually says he needs a long tube pushed up the hole in his penis, then you can be sure he needs it done. You can be faking good too. Had a tooth kicked out. Mouth filled with blood and swelling. I'd stuck a tissue in to try to stop the blood. I've presented to the tridge at the dental hospital. I'm dribbling blood as I talk. She asks me if it hurts and I said a little bit. She looked at me dead in the eye and said one of the many things we tridge on is pain. Double quote. Gotcha. Good nurse. Hurts like a moth FK. I've literally been kicked in the face. Double quote. Thanks for that. Notes taken. Was patched up and out of there within an hour. I once had a patient with appendicitis. Every time I prodded him to check whether he actually had it or not, it would pain in different spots. Soon, it got to a point that wherever I prodded him, he screamed like a stuck pig. I mean, that's a dead giveaway sign that someone's a faker. A few ways to identify someone faking or exaggerating abdominal pain. 1. They howl in pain when you ask, press on their belly and ask, does this hurt? But when you happen to sneakily lean your hand down onto their belly while you are listening to their heart or something, they don't notice. 2. Bump the bed. The movement alone should elicit pain in people with an acute abdomen. I just want to point out that there are many types of seizures and there's a bit of a stigma surrounding people having them. Some people have focal aware seizures and will be able to respond and control their limbs during the episode. It's dangerous to assume that someone is faking just because they aren't experiencing a seizure, like how you expect seizures to look. Nurse here. I had a teenager overdose on Zoloft and start having strange seizure-like episodes. What made them particularly strange is that they all followed a predictable pattern of onset. First, he would lower the bed. Next he would turn the TV volume down. And finally he would check to see if I was nearby. There was pretty severe thrashing about without any abnormalities in breathing. heart rate, pupils, and he was still able to communicate with me throughout the entire episode. And surprisingly, he also failed to show any abnormalities. Vital signs. If you say you're in excruciating pain but your heart rate is 65, then I'm pressing X and doubting you. If you are short of breath but you are breathing at 12 times a minute, normal instead of fast, and your oxygen saturation is 100%, then the problem isn't in your lungs. Anxiety can present like this, which isn't faking it, but it requires seeing past what the patient is telling you. If you tell me you've been clean from meth for a month but your heart rate is 120, then I'd like you to pee in this cup. Not a doc or nurse, but as a patient it's really messed up when they think you are faking. I had an extremely bad year last year and was almost daily losing consciousness. Couldn't keep food or some days water down. I collapsed one day after having horrible stomach pains. The ER doc, doing his job, very quickly assessed me and had them give me Dilaudid, thinking I was probably going to be rushed into surgery for gallbladder removal. At the time this was understandable. However, this particular medicine made me become completely unconscious. They were then not able to do my intake or ask me additional questions. The next doctor assumed that I was on drugs because I shouldn't have had that reaction. He ran all sorts of drug panels on me and they of course all came back negative. They then had to give me Narcan twice to bring me back, as I was out for much longer than I should have been. I'm much better now, but that was an absolute horrible experience. I don't remember all of it, but I do remember my sister, who was there with me, was in tears from how I was treated. She is a medical professional herself and could not believe what was happening in her own hospital. The doctor who thought I was on drugs no longer works there. Not in the medical field, but I've heard an old nurse's trick. If someone is pretending to be unconscious, then lightly brush your fingertips over their eyelashes. If their eyes flutter, they're faking it. Another for faking unconsciousness. Lift their hand high above their face and let go. If it does not hit their face, they're faking it. Another for faking unconsciousness. Lift their hand high above their face and let go. If it does not hit their face. Obligatory, not a doctor, but I got a call from my son's school nurse when he was in 2nd grade. And the conversation went like this. Nurse, sounding upbeat and cheerful, says, "Your son wants to tell you his terrible news." Double quote. Son gets on the phone. Says, "Hi mom. I cut my finger off." Double quote. I ask him, "Where is your finger now?" Double quote. "Son, I put it back on." Double quote. I said, "Can I talk to the nurse?" Double quote. Nurse gets on the phone again. Says, "Sounds serious, right?" I asked, "Does he have a substitute teacher today?" Yes. I told the nurse to let him know I will take him to the hospital for a shot for his finger. To which he says, "I think it's okay. I glued it on really good." Double quote. Nurse kept him in the office for a bit to talk about scary changes in the classroom. ER doctor here. It isn't hard to tell if most patients are full of shit, but it does take experience. It's very easy to let your preconceived notions drive you, and unfortunately they can be wrong. Unless you're sure. And even then, it's better to err on the side of trusting people and over-testing treating. Then there are the seekers. We know them well. Knowing medications by name is a red flag. Telling me that the only thing that works for you is the one that starts with a D, Dilaudid, is going to get you Tylenol. Refusing to take oral medications because the only ones that work are IV is a sign that you're not really in pain. People in pain will take anything offered in hopes that it'll stop. Writhing around and yelling usually makes us hate you and not believe your pain is real. Being mean to nurses will get you nothing. Assaulting nurses will get your ass thrown out of the department and the police called. Refusing to leave will earn your security guard escort out. It's always the nice ones who end up with the worst diagnosis. We feel for all of you. Even if there's not much I can do to help you. Edit. Here I am working a shift and apparently everyone has a problem with me saying if you know a medication by name then you're automatically a drug seeker. Obviously it's more nuanced than this. But please, by all means, Keep telling me how horrible a doctor and person I am. Last time I went to the hospital I was treated like shitty and ignored the whole time despite being in the worst shape of my life and got charged an arm and a leg for less treatment than I would've gotten laying in bed at home in terrible pain. So thanks to this thread for reminding me how often medical professionals think people are faking and people like me get treated poorly as a result. Reminder of why I refuse to ever willingly go to the hospital for as long as I live. I don't know why anyone would want to fake anything medical. Unconsciousness in particular. I got a compound fracture recently and called 911 on myself and was put on hold. Fun stuff. But got through and asked them to send help. Operator was a badass and kept asking me questions to keep me conscious. The ambulance folks arrive. Casually got out of the ambulance. Walk up to me and then saw the bone sticking out of my body. And said, quote, "Oh, you're actually hurt." Double quote. Yes. Did you think I called 911 because I spilled some lemonade? Then it occurred to me that most of their calls must be horseshit. But to cause me even more confusion, I received close to a $2,000 bill for the privilege of actual help and the ride to the hospital. That ludicrous bill is no fault of the M's. I'm very much appreciative of their existence and they don't get nearly enough credit. But the best part of receiving that bill? The ambulance ride was roughly $1,850. The fentanyl they gave me was $2.15. My wife is a nurse and used to work on an adult unit, now works in NICU. She said there used to be drug seekers that would come and stating they were in the worst pain they had ever felt and they needed pain meds for it. Often asking for a specific drug. After leaving the room to talk with the doctor and getting the appropriate prescription filled or denied. Upon her return to the room to give the patient their drugs, she would often find the patient soundly sleeping in their bed. Someone who was in 10/10 pain 15 minutes earlier is now just taking a nap. A lot of the doctors would tell her to just spill out the drugs and give the patient some saline. Then send them on their way. The opiate epidemic hit our part of the US pretty hard. Not a doctor but shadowed a nurse at a school once and she told me that if someone coughs after every sentence they're faking it, or if someone has a sprained blank and the skin in the specified area isn't flushed then it's fake. The last one is what happened to me. It was right when the pandemic was in full gear and I had pain in my rib area. I did a telehealth appointment with my doctor and showed him where it hurt. It wasn't red, swollen, or anything. Well, I went in for an x-ray and I had a broken rib. I know you said sprained, but I figure a broken bone would cause more swelling bruising than a sprain, which is what I initially thought it was. I am in the middle of being treated like I'm faking and it's really frustrating. I had a tool slip at work and hit me in the eye and forehead. Knocked me out for a second and I lost sight in my eye. An hour later I started getting my sight back. But it hasn't fully come back. It's been months now. Two things I got diagnosed with were ocular migraines and vitreous detachment and a concussion. But none of those things explain why my vision is still blurry in my right eye. Except the VD which causes floaters. But my issue is blurry vision. Like I have Vaseline in my eye. But doctors keep telling me I'm fine. That I need to go back to work. One doctor told me to think about the economy and that I was lucky to have a job right now, so I quit my job. I still want to see out of my right eye but none of the doctors are taking me seriously. I worked for a mental health after hours phone line. We'd get calls ranging from lonely people wanting to talk to police officers requesting a counselor to come out with them to deliver terrible news after a car accident. One night I answered the phone and it was a woman saying I just swallowed 8 Tylenol extra strength and 3 razor blades. What you gonna do about it? Like she was asking about the weather. I thought she was being too matter of fact to be entirely truthful. But maybe it was her resolve. Didn't matter. I just transferred her to crisis mobilization. Wasn't my job to judge. I got accused of faking it for 6 months. Went to multiple doctors about a chronic pain in my left ribs and numbness in my left arm. Turns out, I wasn't. After 5 months of trying, They finally decided to run more than the standard chest pain protocol tests. I had injured a nerve in my thoracic outlet. Point is, not all fakes are actually fake. Some doctors are just incompetent. Most if you live in Finland. Honestly, my wife just needs to show up at emergency, and for some reason they always assume she is faking. A nurse tried to discharge her when she had an ectopic pregnancy, saying it was the stomach flu. 4 hours later she was in emergency surgery. She has hypothyroidism. But nearly all male doctors don't believe it's a real condition, so keep trying to take her off her meds or reducing them. Apparently this is somewhat of a common issue. She recently fell in the stairs and FK'd her leg up. It took 4 A&E visits before they sprayed her leg despite the swelling and bruising. She was sent home from hospital when we first got together and had blood poisoning. Collapsed on the tube on the way home and straight in an ambulance for another 3-day stay in hospital. It's a nightmare to watch, as it's almost guaranteed at this point they will not take her seriously. A teenager presented with hip pain and had been through the emergency department previously. Their story did not add up at all, and neither did the pain presentation on assessment. As it was in a public health system, we were able to continue to see them to work through the concern. My colleague ended up having them in hydrotherapy, where their painful side limp switched from when they entered the pool to when they left. This is gonna offend a lot of people. People who are in pain do not move much. They don't want to exacerbate things. Exception is if you hit your hand and immediately shake it around. Even after that you cradle it. Anxiety patients thrash around a lot. If you say you're in 10/10 pain and chatting on FaceTime or talking selfies, I'm calling bullshit unless you're a diagnosed chronic pain patient. 10/10 pain is crying in place chanting help me, help me, help me, or actively delivering a baby vaginally without epidural. If you list 100 allergies, not just like 3 or 4 including foods and nuts, then there's often a psychosocial thing going on. There are exceptions, of course. But often when I go down the allergies, they just list known medication side effects or bland stuff. Most penicillin allergies, statistically speaking as per peer-reviewed research, are not legit. A nurse thought I was faking that I could not swallow when I woke up from jaw surgery. When I came out of the surgery and was panicking telling them I couldn't swallow my own saliva, the nurse just told me yes, you can. This surgery wouldn't have anything to do with your ability to swallow. I could also barely speak and started crying and pleading with her to believe me. I ended up having cranial nerve damage that paralyzed half of my tongue, trachea, esophagus, and vocal cords. It took 8 months to heal. I drank thickened water, which is as gross as it sounds, for 8 months. Having a doctor not believe you during trauma is absolutely scarring. Ortho here doesn't happen very often, but on occasion I'll get a patient who has the ability to dislocate a joint and will hold it out by positioning said limb in such a way that it stays subluxed. They will scream in agony when the ER docs try to reduce the dislocation. Most times, they aren't able to get past the lightest contact with the affected limb. Oftentimes this is in conjunction with said patient telling everyone exactly which drugs, as well as dosages that work for them in regards to pain control. He'll get there, have someone from anesthesia come and sedate the patient, and when they relax, magically the subluxed joint relocates all by itself without manipulation. Refuse to prescribe narcotics. Only give them a prescription for Tylenol or ibuprofen and discharge them. 100% guaranteed they will not return.